probably the biggest reason is that, what might work in Yakima might not work in Seattle.
House Bill 1868 was passed in the Washington House on February 13th, now heading to the Senate for discussion. The bill is designed to set safe staffing standards when it comes to things like overtime and enforced meal and rest breaks. While that may seem straightforward, both the Hospital Association and the Nurses Association have been arguing about how this bill will help the hospital staff.
Although I do believe the intentions are good to, look at how we can, make changes in staffing. There's a lot of concerns about how the nursing shortage and the pandemic and a healthcare system and a society that has been permanently changed, and we're just not sure a year from now what healthcare will look like, what our world will look like, right?
The Washington State Nurses Association has been advocating for this bill for a while now and is surprised not everyone is on board.
We're disappointed that the hospitals have opposed this so strongly, because I think it will help them in providing the kind of care that they need to be providing, and also in retaining nurses and healthcare workers. That's the biggest problem right now in terms of the so-called shortage is really a shortage of nurses and other healthcare workers who are willing and able to work under these extremely and increasingly difficult conditions.
Both sides bring up staffing and the problems that come with that. But what they don't agree on is why.
And with the exception of just a few years, maybe like in the late 80s, we've struggled with staffing for like 100 years. So this isn't brand new. And the reality is that, some nurses probably would come back to the hospital if you pay them more, but most won't. They have other work they're doing. There's other reasons that people don't work right now.
Our members, the nurses in this state, those who are members, and really all nurses that we've heard from and that our coalition partners have heard from, are really hurting right now in terms of what they're able to do and how far they can be stretched in providing for safe and quality care for patients. And this is a solution that has become extremely popular. It's really what our members have been demanding.
The Hospital Association says the main reason they are not for the bill is because the staffing crisis and mandated ratios cannot be approached by a one-size-fits-all solution.
Staffing is not, first and second grade math. It's like, AP calculus, and it's like graduate level physics. It's really hard and it's really complicated.